Hello and welcome. Today, we're going to talk about something that's at the very heart of caregiving, grooming and dressing. And we're going to see how these everyday routines are so much more than just a checklist. They're actually powerful opportunities to show someone you care, to honor their dignity, and to really affirm their humanity with every single action.
So let's just start with the most important question of all, one that should really guide every single thing we do. What are we really trying to accomplish here? Is the goal just to get someone clean and put their clothes on? Or is there something way deeper going on?
The answer? Well, it's actually pretty simple, but it is incredibly profound. The whole point, the true purpose of care, is to preserve a person's dignity and to affirm their humanity. Every time you help, whether it's combing their hair or buttoning a shirt, it's a chance to send a message. And that message is, you are valued, you are respected, you matter. This right here, this is our North Star.
Okay, so with that as our foundation, let's dive into our first topic, the dignity that's wrapped up in grooming. We're going to look at why these small, daily acts are just so incredibly powerful for a person's spirit and their well-being.
You know, grooming is really where the physical and the emotional parts of care meet. It's not just about looking good, though that's part of it. It definitely boosts self-esteem and just makes a person feel more comfortable. But it's also about health, preventing skin problems and infections. And maybe the most important thing of all, it provides a sense of normalcy, a routine that helps someone feel like, well, themselves.
All right, so let's put that idea into practice. We're going to start with hair and facial care, because these things aren't just procedures, right? They are direct acts of respect that really influence how a person sees themselves and how they feel facing the world each day. Look, when it comes to good care, there is no one-size-fits-all approach, period. For something like hair, you have to think about so many different things. What's their personal style? Are there cultural or religious practices we need to honor? What about health conditions or limited mobility? It's not just about getting hair clean, it's about respecting the entire person.
Dealing with tangled or matted hair, well, it calls for a lot of patience and a gentle touch. To avoid pulling and causing pain, always use the right tools, like a wide-tooth comb, and start from the ends of the hair, working your way up to the scalp. And that last point on the list, it's the most critical one. Never, ever cut someone's hair without getting their clear permission first. It's their body, it's part of their identity, and it is always their choice.
You know, for so many people, a clean shave is just part of their daily ritual. It helps them feel refreshed, put together. The process is pretty straightforward. You want to soften the hair first, maybe with a warm, damp towel. Then, and this is key, always shave with the grain, in the direction the hair grows to avoid razor burn and irritation. After that, a simple rinse and pat dry, and you've helped someone feel a little more like themselves.
Okay, I need you to pay close attention here because this is an absolutely critical safety tip. If you're caring for someone who is on anticoagulants, blood thinners, even a tiny nick from a razor blade can cause some serious bleeding. To take that risk off the table completely, an electric shaver is the only safe way to go. This isn't just a suggestion, it is a vital safety measure.
All right, let's shift our focus now to hand and foot care. This is one of those things that can be easy to overlook, but it's so important, not just for how someone looks, but for their overall health, for preventing infections, and for their comfort and ability to get around.
So let me ask you a question that gets at a really key safety point. We might automatically just grab the nail clippers, right? But there are definitely times when a simple nail file is a much, much safer tool to use. Do you know when that is?
Well, the answer is for anyone who has a condition like diabetes, poor circulation, or a bleeding disorder. For these folks, a tiny cut from clippers isn't just a small cut. It can lead to really serious complications, like an infection or an ulcer that won't heal. So the rule here is crystal clear. As caregivers, we file, we don't cut. Any trimming needs to be done by a specialist, like a podiatrist. This is non-negotiable. It's all about keeping him safe.
Next up, let's talk about the art of helping someone get dressed, especially when they have limited mobility. We'll also touch on a few other specialized support tasks. And the goal, like always, is to make the whole process as smooth, comfortable, and respectful as we possibly can.
This right here, this is the golden rule of dressing, and I promise you it is a game changer. When you're helping someone get dressed, you always start with their weaker or affected side first. It just makes things so much easier and requires less straining. And then, when you're undressing, you just do the reverse. Start with the strong side first. Remembering this simple little trick will make life easier and safer for everyone. Okay, this is obviously a very sensitive task, and it demands the highest level of care and hygiene. The steps themselves are pretty clear. You get prepared, you clean the person gently and thoroughly, you apply a fresh brief, and then you dispose of everything properly. But just as important as what you do is how you do it. Your calm, respectful attitude is absolutely essential for preserving someone's dignity during a really vulnerable moment. Now, you might also come across something called anti-embolic stockings. And it's important to know these are not just regular socks. They are actually a prescribed medical device. They're these specially designed elastic stockings, and their job is to apply a steady, gentle pressure to the legs.
So, what's the point of that pressure? Well, by giving the legs a constant, gentle squeeze, these stockings help the blood circulate more efficiently. This is super important for preventing dangerous blood clots, especially in people who can't move around much or are recovering from surgery. They also do a great job of reducing swelling in the legs.
Now, here's the crucial tip for these stockings. Timing is everything. For them to work properly, you have got to put them on first thing in the morning, before the person even gets out of bed. Why? Because that's when swelling in the legs is at its lowest, which means you'll get the best fit and the stockings can do their job most effectively.
So we've covered a lot of the how-tos, a lot of practical skills, but all of that is kinda useless without this final piece. This is the foundation that everything else is built on: consent, culture, and a true sense of partnership.
I want you to really let this sink in. This should be your mantra. It's not about what's fastest or easiest for you as the caregiver. It's all about what the person you're caring for wants and needs, their preferences, their cultural background, and most importantly, their explicit permission must guide every single thing you do.
So, what does that actually look like day to day? Well, it means you respect that a man's beard might be a core part of his identity. It means you understand why a hair covering might be important to someone. It means you change your techniques to fit their needs, not the other way around. And above all, it all boils down to one simple, powerful question you ask before you start anything. Is this okay with you?
So we'll end on this thought. When we shift our focus away from just completing tasks and toward connecting with people, moving from routine to relationship, we completely transform our work. Every time you pick up a comb or a razor or a shirt, you have a choice. So I'll just leave you with this question to think about. How will you make sure that every single small act of care becomes a powerful, undeniable act of respect?